welcome to Connecting Africa. My name is Matshepo, the Associate Editor, and we're joined by Dr. Justus Kilonzi Paul, the co-founder and the COO at Savannah Informatics, on the sidelines of Africa Tech Festival. Justus, how are you?
I'm good, Abdul. I'm very excited to be here.
Thank you.
It's been a fantastic weekend.
Yes, it's been a beautiful week. Now, please let me know how Savannah Informatics is leveraging digital technology to improve healthcare accessibility and affordability in sub-Saharan Africa.
Thank you. So we started Savannah back in 2013. We are 3 clinicians and one finance person. And for us, we were asking ourselves, since we're clinicians, how do we solve the biggest challenges in our healthcare?
Yeah.
And what we find in Africa is we have a big shortage of healthcare workers. So across the whole spectrum. And whenever you have a big shortage, then you need to drive efficiency.
Yeah.
So in our side, we work with insurance companies, hospitals, and patients to really streamline the process of claims and insurance processing. So that's one of the aspects that we're working to do. Then another thing is in a lot of sectors such as banking, telecom, data is leveraged for informed decision making, not so much in our healthcare. So for us, what we're doing is building the digital public infrastructure, which is essentially that the rails that healthcare information flows. And the more that information flows, the more that we are able to have data that informs policy, governance, pricing, quality of care. And then the third point is we are seeing a big burden of non-communicable diseases, such as hypertension, diabetes, and we're working with Roche around breast and cervical cancer. And then what we're trying to use tech is to improve awareness, screening, linkage to care, so that we can catch women before they develop breast cancer. Or if they develop breast cancer, we can also catch them in stage 1 and stage 2. So now we have better health outcomes. So those are the 3 pillars that we're using technology for that.
Oh, that's very interesting. So then could you elaborate on the concept of the triple transition in healthcare and how you guys are addressing that?
Okay, so the triple transition has 3 components to it. That's why we call it the triple transition.
Yeah.
So the first component is Africa has been relying a lot on donor aid, but then we're seeing a lot more countries becoming middle income. So whenever you become a middle income, then funding goes away. Then the other thing is, I think with the US, Europe funding cuts, so there's what we refer to as the overseas development assistance. So again, that's declining. So it means that we have to do more with less. So that's the first transition. Then the other transition is this transition from infectious or communicable diseases to non-communicable diseases. So our healthcare system has been led around TB, HIV, malaria, which is episodic. But then once you treat a malaria patient, in 3-4 days, they become better. But then once you have diabetes, hypertensive, or cancer patients, you need to follow up around their care. So that's the second transition. Then the third transition is insurance coverage has basically been very low in Africa. So if I pick the example of Kenya, it's around 2.8% in private insurance. If you think about South Africa, which is more advanced, around 14%. But then we're saying that we have to shift towards universal healthcare coverage, and we have to raise pool to now we can cover the whole population. So at the moment, we are working with the Kenyan government, so through the Digital Health Authority and the Social Health Agency, and we already have about 20 million people who've enrolled in the public insurance, and our platform is assisting around automation around that. So that's our work around the triple transitions.
Nice. So then what role do community health promoters play in the digital healthcare ecosystem that you guys are building?
Yes. So when you think about healthcare systems that are well designed, you need to focus on primary and preventative and promotive healthcare.
Yeah.
And that's a very big piece. We don't have the infrastructure. We don't have all the healthcare workers for us to see everyone at the hospital. So community healthcare promoters, they essentially go out to the community, they link with the households, and then for us, we are working with them, with the Makueni and the Nairobi County governments in Kenya, so that now they can go out and screen women for breast and cervical cancer. We also use them to mobilize people for hospital screenings, mammographies, and other bits. And then another thing is to sort of provide continuing health education around what are some of the risk factors that make people susceptible to non-communicable diseases. And then the other bit is just sort of bring healthcare closer to the people and build that trust that is extremely important.
I like this. So then how do you guys integrate sustainability and climate action into the healthcare system strengthening?
Yes. So one of the things is healthcare is typically not featured very strongly in climate and resilience and sustainability as well. So for us, what we come in and saying that with global warming, we are seeing unusual disease patterns. So climate is in fact impacting our health. Then another thing is manufacturing a heavy medical equipment
Yeah.
again contributes to global warming, and supply chains that are inefficient again also contributes to global warming. So for us, what we're saying is if we start thinking about health and climate and how these two integrate, then by focusing on primary and preventative care, then we are sort of able to address, to remove the need for the heavy medical equipment. Then the other thing is the more that we automate bigger pieces of the value chain,
Yeah.
the more that we also work towards decarbonizing our healthcare. And then the third aspect is thinking about the effect of heat and health. So I think the people are saying that the globe is warming. Is it about a degree or 2 degree?
Yes.
And that's going to have a big impact in health. So for us is how do you design the healthcare system to be more resilient when it comes to global warming?
I like that. So I've got like indulgement. Like I've got like a nice fun question.
Sure.
What prompted you and your founders to start Savannah Informatics?
I think
What were you doing? Where were you sitting? And you're like, you know what? I want to start this. We started this. What happened?
yeah, so back in med school, we were always experimenting with tech. So we went to high school when tech was essentially starting, and then we were asking ourselves, we are seeing these shifts towards the World Wide Web. And then it became very fascinating. So we're always coding from back in high school. And then we ended up in med school, and we kept on doing that. And then once we finished med school, we didn't quite know how to interface what we knew in healthcare and tech. So ended up going to business school at Duke University in the USA.
Yeah.
And then during that time, there was this transformation. It's got around the automation of our healthcare. So picked up a lot of the learnings. And then when I came back to Kenya, we started our colleagues and said, why don't we build the stuff that works in the West and really contextualize it for the African scenario. So it's been a lot of tinkering and finding out what works. But we like working with each other. We have a really good, fun company culture, and that drives a lot of the solutions that we focus on. But then we always remember that we are clinicians at heart, so we put patients first.
Thank you so much. That was Justus Kilonzi Paul, the co-founder and the CEO of Savannah Informatics. Thanks.
Thank you, and thanks for having us, and enjoy the rest of the thumbprint. It's smooth. Thank you.